I am going to discuss two questions, two clinical based questions, including the histology. So let's go through for the question. A 41-year-old woman complained of excessive menstrual bleeding and pelvic pain of 4 months. She uses an intrauterine device for contraception. Endocardial biopsy shows in this image reveals an excess of plasma cells and macrophages within the stroma. The presence of these cells and the scattered lymphoid follicles within the endometrial stroma is evidence of which of the following condition? So it is a very simple question. They are asking about the examination of the biopsy. 41 lady complaining of excessive menstrual bleeding. Okay, and they given us this histological image, and they are asking that um, in which type of inflammatory process these cells are present. They already mentioned the cell that here present the plasma cells, macrophages within the stroma. So we know that there are two main type of inflammatory processes. Number one is that of the acute inflammation, and number second the chronic inflammation. In acute inflammation, if we only talk about the type of the cells, not about the clinical manifestations, duration of the disease, because the duration of the disease, the type of or we can say the causative organism, the duration, everything, a lot of things that can matter that this inflammation is either acute or chronic. But our main focus in this image on this question is that by seeing the histological cells, or by seeing the inflammatory cell, how we can say that it is acute and chronic. So we already studied that in case of acute inflammation, the predominant cell, the predominant inflammatory cell is there of the neutrophils, and the neutrophils, they are 3 to 5 lobes. Okay, they contain 3 to 5 lobes. I will show the image to you. So can we see any sort of 3 to 5 lobe cell in this image? No, there is no neutrophil in this diagram. Okay, in this picture there is no neutrophil, so it is not an acute inflammation. As they already said that in case of chronic inflammation, we can see macrophages, we can see lymphocytes and plasma cells. So what are the features of macrophages? How we can distinguish lymphocyte from plasma cells and from macrophages? So I will go through the type and the presentation of the cells later, but first we need to solve this question and need to answer this question. So they already said that it is a endometrial biopsy, and in this endometrial biopsy we can see the plasma cells here, okay, here. The nucleus is big and having a cytoplasm, and if you try to find some sort of cells, that what we call as the lymphocyte in the macrophages, we can also see in this particular image that if I try to find the lymphocytes, I can see here is lymphocyte, here is lymphocyte, because in lymphocyte the nucleus is slightly bigger than that of the cytoplasm, so nuclear ratio is more than that of the cytoplasm. Okay, so a large nucleus, and here the macrophage I can find. So it is a case of chronic endometritis. Okay, so the lady is suffering from chronic endometritis. So what they want to ask, they are asking that they are saying that within the endometrial stroma is evidence of which of the following condition. Okay, they already said that there is a plasma cell, there is a macrophages, but which type of inflammation is this? So we got our answer. So either is acute inflammation, it is not an acute inflammation, there is no granulation tissue, there is no granuloma, there is no giant cell. Menstruation is not related to the question. Okay, so our answer is the chronic inflammation. So chronic inflammation is the answer of this question, that the lady is suffering from chronic endometriosis, as the cells of this biopsy tells. So let's discuss with some cells. Before going through this, I will show you this image. Okay, so here we can see different sort of cells: a monocyte, a kidney shaped nuclei, okay, a bilobed nuclei having two lobes like a glasses, and eosinophilic granules, reddish color eosinophilic granule. They are present in eosinophil, so it is eosinophil. The basophil having again bilobed nuclei and blue color granulation, or the blue granules, so that's why it is called as basophil. Neutrophil is 2 to 5 lobed or 3 to 5 lobe cells, so here we can see 3 lobes, and they are neutral cells, so they have equal amount of basophilic substances and eosinophilic substances. That's why they are called as the neutrophils. If we see about this cell, we can see that in this condition, okay, in this case there is a large nuclei and very small peripheral cytoplasm, so it is a specific feature of lymphocytes. So here we can see a beautiful image of macrophages. These are the extensions, cytoplasmic extension, what we call the dendrites. Okay, and here is a nuclei, but nuclei is smaller than that of the cytoplasm, so it is specific for macrophages. And in this image you can again see that here the plasma cell, second plasma cell, and we can find lymphocyte, and here we can see the macrophage, lymphocyte, plasma cells. Okay, so this is the plasma cells and lymphocytes histology. So let's go through for the next MCQ. So a 43-year-old man present with a scaly erythematous lesion on the dorsal surface of his left hand. A skin biopsy reveals atypical keratocytes filling the entire thickness of the epidermis. The arrows pointed to the apoptotic bodies, so there is apoptosis. Which of the following proteins play the most important role in mediating programmed cell death in the patient's skin cancer? They want to ask either which protein, okay? Either it is catalase, cytochrome C, cytokeratin, myeloperoxidase, superoxide dismutase. So if you see this histological image, this is what the layer of keratin at the top, and the entire thickness is the epidermis. Here we can see that the cells are highly packed and the keratinocytes have atypically large nuclei. So whenever you can see atypically large nuclei, you should think about the cancer. So it is an example of squamous cell carcinoma. We can see atypical cells, okay, and the thickness is very much. And apoptotic inclusion bodies. So whenever the cell undergoes apoptosis, okay, there is a formation of apoptotic bodies. The cell destroy the cellular component. They are packed into a membrane bounded structure, and these bodies what we call as the apoptotic bodies. So they want to ask that which cell or which protein is important or play a role in apoptosis. So if you know about the pathway of the apoptosis, there are two pathways, intrinsic and extrinsic pathway for the apoptosis, but I will not go for the detail of those pathways, but I will just say some words and so you understand and can give answer of this question. So we know that any substance or any stimulus mutation is one of that can causes if there is a genetical mutation, okay, then definitely the cell need to undergo a process of apoptosis. There are some pathological apoptosis, some physiological apoptosis, okay. So the mitochondria play a very important role in maintaining the cell survival of the cell, okay. So in this mitochondria, the mitochondrial membrane, it play a very important role. So whenever there is a damage or damage of the DNA or some other factors, then what happen, the mitochondria become porous, okay. The channels in the wall of the mitochondrial membrane or the mitochondria, they open. Whenever they open, enzymes come out. That is what we call as the cytochrome C. When this cytochrome C comes into the cytoplasm, it causes activation of a series of caspase enzyme, especially caspase 9, caspase 8, okay. These caspases, a cascade of caspase, the procaspase convert into caspase, then caspase 8 to caspase 9, a series of caspase enzymes, they activate one by one, and finally these caspase enzyme activated different sort of proteolytic enzymes, including the protease, including the endonucleases, okay. All those enzymes, what it do, they starts to destroy proteins and the DNA or the nucleic acid. In this way, the cell undergo a process of apoptosis. So here, if you see, can we find cytochrome C? Can we find caspase enzyme? Yes. We can see here that the cytochrome C. So the answer of this is cytochrome C, which plays an important role in apoptosis, okay. So thank you for your attention.